So, thank you for having me. My name is Dr. Safiya Cummings. I am a lifestyle medicine physician and an environmental designer and a carbon literacy trainer. So, today I want to make a cause that I believe is urgent, evidence based, and deeply personal for everyone in this room. We spend a lot of time in climate tech talking about emissions, technology, policy, and infrastructure, and all of that matters. But today I want to talk about something more intimate: the home, the place where we sleep, raise our kids, recover from illness, and spend most of our lives. I want to make the case that in a climate disrupted Maryland, the home is either one of or most powerful health tools or one of our greatest health threats. So let's begin. What if your home was the most powerful prescription your doctor never wrote? We think about healthcare as what happens in a clinic, but the research tells us something very different. Where we live, the temperature inside our walls, the air we breathe, the light that reaches us, and whether our floors get flooded, these things are writing our health outcomes every single day. And climate change is accelerating that process. The home is no longer a real estate question, it is a public health emergency. So here's how we'll spend our time today. I've structured this as a journey from science to Maryland's specific reality to the health consequences that we are currently seeing, to what a climate resilient, healthy home can actually look like, and finally to what each of us within this room can actually do about it. I want this to be useful whether you're a homeowner, a clinician, a developer, a policymaker, or an investor. There is something here for everyone. So let us start with the science, and I want to ground this in something that might surprise you, because most of us have been taught to think about health in terms of genetics and individual behavior. The evidence tells a more complex but hopeful story. Research consistently shows that more than half of our health outcomes are shaped by social, environmental, and behavioral factors, not clinical care or genetics alone. And according to varied values by the CDC, the WHO, and the HHS Healthy People 2030, they all converge on a figure of about 50 to 80%. So therefore, greater than 50% of health outcomes is shaped by social and environmental factors and not just your genetics. Now, when we looked at the life expectancy gap between Baltimore neighborhoods, just 6 miles apart, there was a 20-year difference. And this was confirmed by the Baltimore City Health Department's own neighborhood health profiles. This is not countries, this is neighborhoods within the same city. So therefore, our zip codes predict longevity better than a clinical variable. And then finally, 90% of our time is spent indoors. Now, this may be your work environment as well as your home environment, but every single decision in our homes, the materials, the ventilation, the temperature, the light, is a health decision. We just haven't been treating it that way for many years. And this is the foundation of this talk today. The home is a clinical setting. So, how exactly does your home shape health? Let me walk you through 5 pathways. So, we have indoor air quality, and we can think of different particles within the air, particularly the VOCs of off-gassing from your furniture, the mold spores after a flood, the particulates from a gas stove. These can trigger asthma, they can worsen cardiovascular risk and cardiovascular disease, and even promote cognitive decline. In terms of thermal comfort, when our homes are too hot or too cold, our cardiovascular system tends to work overtime to kind of regulate our bodies. And sleep disruption from heat exposure raises cortisol levels and increases metabolic risks. So this is not trivial at all. Light and circadian health. Natural light regulates our sleep cycles, immune function, mood, and hormonal balance. Poor daylighting in homes is a silent driver of depression and immune suppression. Noise. Chronic noise exposure from traffic or nearby development measurably raises blood pressure and inflammatory markers, and hence it is also counted as a cardiovascular risk factor. And finally, access to nature and biophilia. The presence of plants, natural textures, views the green space. These demonstratively reduce anxiety, lowering blood pressure, and speed recovery from illness. And this is the science behind biophilic design, and it's central to how, we can approach environmental design. So now let's bring this home, literally to Maryland, because the climate risks facing the state of Maryland are not hypothetical. They are here accelerating and they are reshaping what it means to be and own a home in Maryland. So, Maryland faces 5 distinct climate threats that directly affect the health of its homes and the people inside of them. Sea level rise and flooding. With 3,100 miles of shoreline, Maryland is among the most exposed states on the East Coast. Baltimore could see up to 155 high tide flooding days per year by 2050. By 2100, 68,000 Maryland homes and housing for approximately 100 and 200,000 people face chronic inundation. In terms of extreme heat, it is expected that about 41 days of extreme heat will be experienced per year by 2050. Urban heat islands amplify this in Baltimore and other cities where low-income residents in poorly insulated homes bear the highest burden. Severe storms, more intense hurricanes, more flash flooding, more infrastructure failure across regions in Maryland. Drought and water stress, worsening supply to demand ratios through mid-century affecting home water systems, landscaping, and agricultural communities in Western Maryland. And finally, insurance and financial risk. Approximately $10 to $20 billion in disaster costs were experienced since 1980. Coastal insurance are withdrawing, and there is a financial crisis compounding this health crisis. It is important to understand that climate risk is not equally distributed across Maryland, and critically, it is not equally distributed across populations within those regions. The Eastern Shore faces the most acute sea level rise exposure. Dorchester, Somerset, and Worcester counties are already losing land. Central Maryland and Baltimore face intense urban heat and flash flooding, with legacy housing stock that is particularly vulnerable. And I want to say this clearly. Low-income residents and communities of color in Baltimore face disproportionately higher climate health burdens because of decades of underinvestment in housing quality. Western Maryland faces emerging drought risk and intensifying storms. And when we think about it, race and income remain the strongest predictors of who bears the heaviest climate health burden in Maryland. Any climate resilience strategy that does not center around equity is incomplete. Now, I want to talk about what this is actually doing to people's bodies and minds, because I think this is where urgency is critical. So let me start with extreme heat because it is the leading climate-related cause of death in the United States, and it is profoundly underestimated. When a home cannot maintain a safe indoor temperature, the cardiovascular system is under constant strain. The heart works harder to dissipate heat, and for elderly residents and for those with hypertension and for pregnant women, this is a direct mortal threat. Sleep disruption from heat exposure raises cortisol, and chronically elevated cortisol drives insulin resistance, obesity, and cardiovascular disease and immune suppression. So we're literally heating people into chronic illness. In a landmark study of about 3.5 million emergency department visits found that extreme heat days were significantly associated with increased mental health emergency department visits for anxiety, substance use, and mood disorders. So, heat can be a mental health crisis. And kidney disease, chronic dehydration from hot indoor environments, is emerging as a significant driver of kidney disease, particularly in communities without air conditioning. So, in Maryland, 41 extremely hot days per year by 2050 means this is not a future problem. This is a now problem. Flooding creates a second cascade of health consequences that I don't think we talk about enough. Mold colonizes within 24 to 48 hours of water intrusion. The mycotoxins it produces are implicated in respiratory illness, immune suppression, and emerging research suggests that neurological symptoms, including brain fog and depression. In 2024, a peer-reviewed meta-analysis found that children in moldy homes have a 53% higher risk of asthma. On indoor air quality, here's a counterintuitive problem as we make homes more energy efficient. Without proper ventilation, we can trap indoor air pollutants. And the energy recovery ventilator is a critical component in a healthy home that most renovations still don't include. In terms of mental health, a systemic review and meta-analysis found that PTSD affects nearly 30% of flood survivors. This is profound and largely invisible. Why? The loss of a home is the loss of an identity, safety, community. Climate anxiety is now a recognized clinical condition and is rising fastest around youth who understand what's coming. The home is not separate from mental health. It is one of the most powerful determinants. So what do we do? This is where I want to shift from diagnosis to prescription, because the evidence of what a climate resilient, healthy home looks like is robust and design framework to deliver it exists. So I organized the climate resilient healthy homes in terms of 4 pillars. So pillar 1 is around thermal performance and energy resilience. So this means a continuous insulation envelope, cool or green roofing, passive cooling design, and heat pump systems. Done right, this keeps homes thermally stable in extreme heat and cold, which is, as we have established, clinically necessary. Pillar 2 is flood adaptation and water management. So elevating structures and installing flood vents and backflow valves, using mold-resistant materials throughout, and critically embracing living shorelines over hardened armoring. Maryland state policy now favors living shorelines, and rightly so. For Pillar 3, the healthy indoor environment, so we'd look at low VOC materials, balanced ERV ventilation, biophilic design, daylight plants, natural textures views to nature, and designing to add call some building certifications such as Reset, Fitwell, and Well Building Standards, which give us measurable tangents for healthy indoor environments. And Pillar 4, carbon literacy in every decision, embodied carbon awareness, electrification, solar readiness, EV charging roughing, and helping homeowners navigate the financial tools available to them. These are very essential to homes now preparing for the climate crisis. So let me make this concrete with a before and after. The typical Maryland home can be under-insulated with gas appliances, no mechanical ventilation, conventional materials with no flood adaptation. And that can silently create conditions for cardiovascular strain, respiratory illness, mold exposure, energy insecurity, and rising utility costs. So it's not a neutral space, and it is an active health risk. The climate resilient healthy home flips every one of those risks. Stable thermal comfort, clean indoor air, mold resistance, stormwater management, energy independence, and biophilic environments that actively support well-being. This is not a luxury. I want to say that clearly. The most expensive outcome of doing nothing in terms of flood damage, emergency medical care, chronic illness management, these are the real costs of inaction. So, as much as we like to speak about the health risks, many would like to know what's the return on investment. So, the return on investment is real and measurable. Energy efficiency upgrades, insulation, heat pumps, smart controls can cut home energy use by 31 to 47%, with median annual billing savings of 300 to 650 US dollars for most eligible households. For those switching from propane or oil, savings can approach up to 1,000 US dollars per year. The Inflation Reduction Act makes up to $10,000 or more in federal tax credits and rebates available per household for these upgrades. The money is there, and the challenge is actually navigating access to it. Climate resilient and healthy certified homes are beginning to command 7 to 15% property value premiums, and the market is starting to price health and resilience. And the healthcare cost reduction is harder to quantify, but it is real. You'd have fewer emergency room visits, better chronic disease management, improved mental health outcomes, and a well-designed home is preventative medicine at scale. So, I want to spend a moment on money because the number one barrier I hear from homeowners is I can't afford this. So, the IRA is the largest federal investment in clean home upgrades in American history. Heat pumps, insulation, solar, these are now heavily subsidized, and lower income households can get direct rebates, not just credits. Maryland has its own resilience revolving loan fund, specifically for home resilience upgrades, and the Bay Restoration Fund supports shoreline work. The Maryland Energy Administration runs weatherization programs for low and moderate income residents, and FEMA's National Flood Insurance Program is separate from standard homeowners insurance, and many Marylanders in flood vulnerable areas don't carry it. The community rating system offers discounts in participating counties. So these are things to look at as the funding exists, and knowing where to look is half of the battle. So we're in the final section now, and I want to close with something I genuinely believe. Maryland is at a defining moment, and the decisions that we make about homes in the next 5 to 10 years will determine the health of this state for a generation to come. So let me close with a specific call to action, because I think different people in this room have different levers to pull. For homeowners, know your risks before your next renovation decision. Use FEMA flood maps and First Street Foundation scores and start with the highest impact upgrades: insulation, ventilation, flood barriers. Apply for IRA credits now and consider a climate resilient, healthy home assessment as your starting point. For clinicians, start asking about the home in your social history. Prescribe healthy home assessments for patients with asthma, heat illness, or anxiety disorders. The home is a clinical environment, treat it like one. For policymakers, climate resilience standards need to be embedded in Maryland building codes, and equitable access to resilience upgrades must be funded. The communities with the least resources face the highest risk, and housing needs to be explicitly integrated into Maryland's health and climate adaptation planning. So let's close with a vision. A Maryland where every home is a prescription for health and not a source of harm. The home of the future is not just energy efficient, it is thermally comfortable, flood adapted, mold free, clean air, biophilically rich, and health promoting by design. That home is achievable, and the science is there, the funding is there, the design framework is there. What we need now is the will to build it and the wisdom to understand that housing and healthcare are not separate systems. They never were. Thank you. I'd love to take your questions.
Wow, that was a very powerful presentation. Thank you so much. I appreciate it. So it's obvious that you are local to Maryland, that you either went to the University of Maryland, Baltimore County, UMBC, or how about Maryland, University of Maryland College Park, maybe John Hopkins is where. No, where are you based that you should know so much about Maryland?
So I actually did a deep dive on it just specifically for the Maryland Climate Tech because I believe in actually speaking to my audience. So I did a deep dive, but I am based in Trinidad and Tobago, and my education is between the University of the West Indies and the University of Edinburgh in Scotland. So
Wow, so you're not you're not based in Maryland. That is amazing. You're based in TNT. I love it. I love it. Well, um, this is why I think, and I'm sure, and I'm positive why you were selected as a commissioner on the Global Commission of Healthy Indoor Air. What does that mean to you to be selected as a commissioner, and how do you see your role as a commissioner with this new organization?
So, as a global commissioner of healthy indoor air, I stand as an advocate for healthy air generally because, I mean, there is ambient air pollution as well as indoor air pollution. So, in my role as a global commissioner of indoor air, I focus on indoor air quality, but I recognize that there is a need for advocacy on both rounds. Why I'd say this is because in terms of air pollution is responsible for approximately 8 million deaths
Mm.
annually across the world. And when we zoom in terms of indoor air pollution is actually responsible for about 3.2 million premature deaths annually across the world. Now, as much as my practice has been in the Caribbean and I did my studies across with the UK, what we recognize is that healthy indoor air is a global concern and it needs to have a focus regardless of where you are located in the world.
So how do you come to this space? I come to this space from reading Dr. Joseph Allen's Healthy Buildings book, and one of the things that are you familiar with the book?
Ah, yes, I am.
Yes, okay. One of the things he talks about was, radon gas comes from granite countertops, and he said, you should monitor your air quality. So I went ahead and bought one of these reset accredited monitors, and I put it in my bedroom. I live in a townhome, so it's on the third floor, and we had extremely high levels of radon to the point where the EPA, the Environmental Protection Agency, says we were smoking, 20 to 40 cigarettes a day because we had such high levels. And from there, this is all during COVID. And then from there, I just kind of geeked out on, mitigation strategies. Of course, we've had it mitigated since, but geeked out on mitigation, particulate matter, VOC. So I come to this space from finding and mitigating radon in my home. And, I've gotten reset accredited. I'm the first and only reset accredited professional here in Maryland. I'm very proud of that. And so I often find myself in rooms where they're focused on, energy savings and resiliency and sustainability, which is all very important, but you could be in a net zero building or a building with a whole bunch of environmental certifications, and still have poor indoor air quality. And so that's kind of how I come to this space. What's your backstory? How did you get here?
So my backstory is kind of interesting. So I have worked clinically as a respiratory physician prior to COVID, and then during the COVID pandemic, I was actually a COVID hospitalist. So what happened is this transition into COVID care made me realize that I wanted to do more for patients because what you find is as a physician, you're treating patients one-on-one.
Hmm.
And the COVID pandemic made us all recognize that there was a limit to how much care that we can give in a day because, there were so many patients coming in and we were just so overburdened. So I kind of switched my focus from internist care into public health. And that's when I started my degree with the University of Edinburgh. Now, with their program, they actually advocate for all of their students to become carbon literate,
Mm.
which gives us an insight into, the impact of climate change on our environment and a responsibility to actually impact positive change in whatever arena of life that we're in. So with this, we were challenged to produce solutions to combat, health in the warming world. That was our challenge. And for that, I kind of did a deep dive on how can I actually improve health in the warming world. And in my deep dive, I developed a solution around integrating plants within the indoor spaces as a means of promoting health and well-being.
Is the rule still 8 plants per person, or have you come up with a different methodology?
So my methodology was different, but I didn't pursue further
Okay.
evidence-based studies in it. But it was more around, the functionality of plants. So when you think about it, you want plants for one aesthetic purposes, which supports the biophilic, theory whereby, when you're watching plants, you get calmer, you feel more, at ease. But then I wanted to integrate it into healthy habits. So in terms of we're promoting healthy lifestyles and we're saying, you should eat a more plant-focused diet. So what if you had the plants that you actually need within your space to supplement that diet? And then even having a garden promotes like different degrees of exercise and different degrees of social interaction. So that was my thought behind it. But outside of that, as I continued my progress in terms of integrating climate change with health, I volunteered with OpenAQ, which is an organization promoting free and open access to air quality data around the world. Now, this is ambient air quality data, which is not indoor, but in your general environment. And my project for that was advocating for schools to actually become aware of ambient air quality and therefore know, at least when to have their kids outside playing or, how to notify parents and when to look out for like asthma attacks. And subsequent to that, I kind of continued my deep dive and then I ended up in indoor air quality. So, I mean, it was a long journey, but I think most of us are recognizing that climate change is integrated in everything that we experience now, and that factors such as the environments we live in, air quality, and water access, and all of these things are now becoming a key factor in predicting health outcomes in the next century.
Absolutely, absolutely. Well said. So I want to, maybe expand and get your take on kind of low cost, high quality, low cost air quality monitors and um, and the validation part of it, because I think a lot of times, like I said, I've been into build. I take my monitors with me everywhere in every building that I go into, and I'm shocked at how poor the air quality is in most buildings. Actually, what it is I'm often elated when I walk into a building that actually has good air quality because it is so rare, especially with the buildings that have the gold and the platinums and the silver, and just the high end buildings or the net zero buildings. Um, you know, I'm a huge proponent of, validating that the building's actually performing the way it should, especially if you've got all these certifications. Kind of how do you look at, air quality monitoring and kind of the validation that air quality monitoring has, seeing as this is now one of the first times in history where we can actually see the air that we're breathing.
So we're having a lot of air quality monitors being produced, but I would stand with the reset standard
Mhm.
as one of the core standards for actually assessing monitors in terms of air quality. I'd like to touch on one point. Now, I mean, different standards have different parameters that you look into in terms of PM 2.5, VOC levels, carbon monoxide and carbon dioxide levels, as well as temperature and humidity.
Mhm.
But at least for the Maryland case, when I was doing my background research, there is a lot of talk about radon.
Mhm.
So I would say for Maryland homeowners and Maryland individuals, I would say to get a air quality monitor that actually specifically tests for radon levels within your indoor environment. That is critical.
Absolutely. So 1 in 4 homes in Maryland have radon levels above the EPA, action limit of 4 picocuries per liter, which is still, smoking 8 cigarettes a day, right? And so, we it We've spoken to a few reset accredited monitor manufacturers. Like those are the only monitors that we really focus on. And we're not finding very many that have radon sensors inside. Airthings, of course, does. So that's, when we're doing our 30-day healthy home checkups. And let me take it a few steps back. We were awarded in partnership with the Forward Women's Leadership Forum, which is a local nonprofit. Shouts out to Colette Coakley, who will be speaking here as well. She's the CEO and founder of the Forward Women's Leadership Forum. We worked with them to get a small grant from our local utility, Baltimore Gas and Electric, BGE, and we deployed and are currently deploying what we call a 30-day healthy home checkup, where we'll drop a reset accredited monitor into the home for 30 days, connect it to the homeowner's Wi-Fi system, and that way we get real-time alerts as radon or particulate or carbon dioxide, VOCs, temperature, humidity tend to spike. We can communicate with the resident in real time to let them know, hey, your particulate matter spiking, are you cooking? It's like between 5 and 8 p.m. You must be cooking. Maybe turn on a hood fan and or turn on your air purifier and try to give them kind of low cost, no cost mitigation strategies. We're finding homes that actually have radon mitigation systems in them
Mhm.
that are not performing. Sometimes the homeowner thinks that just because I have a mitigation system, everything's fine. But no, you need to continue to test it every 2 years or at least validate. And there's this big push in our market as well to remove gas stoves, remove the combustion. And if we make the home all electric, then it must be a healthy home. And what we're finding is that we're finding homes that are all gas, have gas stoves and gas furnaces, actually performing better on a case-by-case basis than homes that are all electric. So we're kind of demystifying a lot of the myths when it comes to, air quality by actually getting in there and monitoring. And so I guess I wanted to get your feedback on you know on such a program as a 30-day healthy home checkup where people are actually monitoring for 30 days to see what's happening. Is that enough time, or should we be doing it a little bit longer?
So honestly, what I'd advocate for is that these homes continuously actually have a continuous indoor air quality monitor. So as much as we do a 30-day program, the 30-day program is based around building awareness. And actually, if you can teach these homeowners what to look out for and
Yeah.
what not to do. So I think after that 30-day program, then what is the longevity of this program? How do they proceed after that? Do they get to keep their monitors or do they now have to invest in the monitors? Because I mean, I don't know, like everybody comes from a different financial background.
Mhm.
So we may have to look into ways of, leaving them with a monitor long term and looking at, how they respond to long-term change. So your 30-day program should be focused on behavior change
Mhm.
and awareness. That's the core of the 30-day. Start by educating them and letting them know, okay, these are the risks within your home. These are your 30-day level exposures, and this is how you should go forward. But I'd always recommend that they have a monitor in their home long term.
Yeah, yeah, very good point. So when they're done with the 30 days, they do get what we call a 30-day real-time indoor air quality impact report uh, to let them know kind of what their averages were for the month and then kind of what our recommendations were. And then also to get a second opinion, like don't take our word for it, right? But then we ran into a situation where we did have a household where it was four members in the household, kind of a single mom, three children, and all of them had asthma, all of them had respiratory issues. And I felt really weird at the end of 30 days, just saying, here's your here's your air quality report. I need to collect my monitor, good luck. And I that did not rest well with me, to your point. So we actually went further and because of that situation, we created what we call the Healthy Home Rescue. And we've partnered with a fiscal sponsor, and now we can actually do the initial, baseline analysis of what's happening within the home, and then, work on a zero displacement retrofit, work on solutions, research-based solutions, whether it's, high-powered, air filters, HEPA vacs, or, we're finding some homes don't even have air filters in the furnace at all. So, trying to see if we can put an M13, a MERV 13 filter in the home. Um, add some circadian lighting and just try to increase. And we're already getting some initial feedback that the numbers are, because we're able to match the air quality numbers from before we started to what they are post mitigation. And we're seeing both the numbers decrease, and we're seeing, from surveys from some of the occupants that, it's definitely, benefited their quality of life. The kids aren't waking up in the middle of the night coughing and heaving because of particulates. So it is starting to work kind of on a smaller scale, on an anecdote scale, but we want to definitely expand that process to your point to actually come in, do the zero displacement retrofit, and then use the air quality monitoring on the back end to validate that we actually solved the problem, and then come back on a 3-year cycle and continue to monitor and validate that the situation has actually been resolved, whether it's a radon mitigation or removing the particulate matter.
Beautiful, because I think that is the core purpose of having a program like that to actually effect long-term change within homes.
Hmm.
And what we find with indoor air quality is that individuals with asthma, COPD, and other respiratory conditions, as well as cardiovascular risk, they are the most vulnerable population groups. When we think about it, it's children, the elderly, pregnant women, and people within these disease groupings. So I think you're doing great work. I love the efforts, and I hope that there will be more support and more funding to actually help individuals who actually don't have the finances to actually do their own personal retrofits. So that is great. In terms of, I know you identified a family with asthma. What I'd recommend is also tying in how the impact of the air quality is actually relating to their symptoms.
Hmm.
So I'd recommend looking into something called the ACT score, ACT score. They have it for the pediatric population as well as the adult population, where it actually trends the different symptoms that they experience from asthma and how well controlled they are. So that would be a nice factor to tie into your assessment protocol.
I appreciate that. Thank you. That's very helpful. Talk to me about, I'm not sure how familiar you are with it, but I know here in the States, healthcare institutions are, legally required to contribute. Nonprofit healthcare care institutions are legally required to contribute a percentage of their income to community benefits. It's called healthcare community benefit dollars. I'm not sure if you've heard of it, but there's kind of an ethos of healthcare financing for healthy homes. Do you have something like that, or have you heard about something like that across the globe, or is that kind of something that's happening in the United States?
I think this is something that's happening in the United States, but I actually haven't looked into it, so I don't know because
Hmm.
I like generally people look for governmental funding and other NGO support from philanthropies,
Hmm.
but this is a very nice initiative, so I think it's great to adopt globally.
Yeah, absolutely, because it goes to directly to addressing the social determinants of health, and the home being the number one determinant of health. So we have some folks that we work with locally that kind of have their pulse on that, but we'll see if we can't dive into that a little bit further. So Dr. Cummings, Sath, uh, is there anything that I didn't ask you that you want people to know about kind of the work that you do on a global scale with the commission, or what you do with your own firm?
I don't think there's anything that you did not ask me, but I think anyone who wants insights on terms of how to improve their environmental design for health or even lifestyle medicine advice, they can always reach out to me at my email at the bottom of the screen, saf@lifestyleadvice.com, or just check out my website.
Absolutely. No, I appreciate that. We're very intentional about making sure that Maryland Climate Tech 2026 is the most diverse group of subject matter experts. We do this during Women's History Month intentionally, and we focus on kind of the women that are in this space and doing cutting edge things like yourself. But it's always great to see someone that looks like me that's in this space along with me, and someone that I can learn from as well, because and I'm sure you'll admit it's pretty rare as you go to different conferences and things across the globe that it's always a good thing to see someone that looks like you that's doing good work in this space.
Yes, it is.
So thank you for that. All right. This is Aaron Rice with Dr. Saf. I appreciate you coming and your thought leadership, subject matter expertise. Presentation was right on point. Thank you so much.
Thank you. Pleasure.
All right. Have a great day.
You too. Bye.